you know what he said? That's because you're fat. I was like, am I not the woman with the issue of blood? So people hear you have PCOS or hear that you're bleeding and they automatically think that you went to do abortion. Give me 5.
You're welcome.
Hello my loves, welcome back to my YouTube channel. I know that I have not put up a video for some time now, and I was just basically caught up with hospital events, and so I am here to make it up to you guys. Today we're going to be talking about a very important topic, a topic that people have actually approached me to ask me some questions about, and there's something very spicy that we're going to be doing on today's video. I have a guest for the first time ever on my channel, and this is somebody that, don't worry, let me just leave the person's profile. When it's time to introduce the person, you guys are gonna see who the person is. So today's topic is PCOS, polycystic ovarian syndrome. So PCOS is a very important topic to discuss because I've had people meet me to tell me that they are having this condition, and a few things that they've been experiencing, how they could go about it and all of that. So I decided to just address the topic because I just want to clarify a lot of things and to just literally throw more light on it. So polycystic ovarian syndrome is basically an abnormality that affects the ovaries. As a female, you have 2 ovaries, and basically what happens is that for literally no known cause, the ovaries just start to have cysts, multiple cysts, just become cystic like a fluid-filled cavity. And this is also accompanied by anovulatory cycles or absent ovulation. So the person would complain of not ovulating, and there's also increased androgen production or androgen excess. So these are like the 3 core symptoms that make up this syndrome. But then basically the polycystic ovaries, that's the multiple cysts that are usually seen in the ovaries, are basically seen on ultrasound scan. So probably a transvaginal ultrasound scan may be done to visualize these cysts on the ovaries. So people have complained about the symptoms that PCOS can cause or can bring, and they vary from weight gain to low libido to acne to irregular menstruation to insulin resistance to so many more, excess hair production, they call it hirsutism. You may have fertility issues. So these are like the symptoms that can come with polycystic ovarian syndrome, PCOS. So today on my channel we have a very important guest speaker, and I am glad and grateful because not everybody would want to willingly share their medical conditions to people they don't know personally, and she has taken up the courage to do that. And I just had to ask her, and she's like, of course, that she's willing to talk to people about it. So you're not just going to be listening to me, you're going to be hearing it from the horse's mouth. And so I would introduce our guest speaker. She's no other than Chisom Paula Ogamba, my sister, I know. So she is a lecturer at Alex Ekweme Federal University in Dufo-Alike in Ebonyi State. She's a PhD student at Babcock University, Ogun State. She's also a sociolinguist and a social media personality, a Twitter personality to be precise. So guys, drum rolls, let's see our guest speaker for today. Hi Chisom.
Hello.
So thank you for granting this request. Well, you didn't have a choice.
I did have a choice. I did not have a choice, so let me just say it now.
Thank you for granting this request to come and speak to my viewers about PCOS, knowing that you're actually experiencing it. So thank you for your willingness to share your experiences with us.
Obviously, I mean, I'm a willing participant. I'm not going to lie, because I've really been very, outspoken about it. I've never, shied away from talking about PCOS.
So, the first question. So I'll just be asking you questions, and then feel free to explain the answers as much as you'd want to.
Okay.
All right. So the first question would be, when did you first notice that you had PCOS, and how was it for you? How was PCOS for you?
Will I say when? I feel like from the very first time I started seeing my period. Okay. For the first time, it's not supposed to be serious or heavy. That's what we were told in school, biology and the rest. Very first time I saw my period, it was heavy. I didn't know it was PCOS. I thought it was normal, normal period, cycle and everything. So that was like looking back, that was the first time I can say, that I experienced an abnormal, period cycle. So after that, after your first period, you not see your period for a while. The first time I was sure that, okay, there's something wrong. So it was in 2013. I just entered Unilag. That's still a child. You are a child, so you will not know. So let me just tell you now, she was still a child. So I was not seeing my period. I had not seen it for 6 months.
Yeah.
As at that time. I'd not seen it for 6 months. I was not even bothered, right? Because as young girls, we didn't care. So we didn't even want it to come out.
Exactly, because periods are like stressful,
disruptive.
I swear,
they are disruptive. So like I was not bothered. I was like, it's not coming out. I've always had terrible cramps.
Yeah.
Throughout secondary school, I've always had terrible cramps, heavy flow. Like, always now, the blue and the pink. I've never used the pink one. I said, wow. I said, okay, let me tell, mommy. So I was like, mommy, see you. First of all, I've not seen my period in months. And secondly, this was coming out. I showed her. And she was like, okay, let's go to the hospital, right? Because she has always known that my period, has not been,
so
your own was normal, no heavy flow and everything. So she has always known that my own was my own was like, serious. So she was like, okay, let's go to the hospital, right? So we went to our family doctor.
Yeah.
Do you know the first thing he said? Do you know what he said? That's because you're fat.
And that was so insensitive. I always say this in my hypertension video, like you have to know how you refer to people's weight. You have to know how you talk to people about their weight, because it's always very sensitive. And you being a child, and him just seeing you, and you're complaining about something that is bothering you, and you're adding more stress.
It was the first thing he said.
No, that was
I'm fat now. That whole period come out. The fat has blocked all the.
So I think doctors need to do better in this regard.
It was hurtful. Yeah.
Take things like you have to understand your patient's psychology, the age, everything before you just blot things out. And for someone to come to you with a complaint, this is something that is bothering the person. The person has decided to come and open up to you. So you shouldn't take it for granted. You shouldn't cause more distress to this person by pointing out, things that you feel that this person may be insecure about, right? Yeah, I'm so sorry about that.
It's fine. But after saying that, he said, okay, that he's not a specialist in that, but he's going to write like a series, like for me, like to do a series of tests, So he wrote, hormone profile. I can't remember. I wrote the hormone profile. He wrote some hormones: testosterone, estrogen, progesterone. For me to get, to test that. And then he said I was going to do a what's that?
A scan?
Yes.
Transvaginal ultrasound scan.
Yes, the TVS.
Yeah.
So I was going to do that so that we can, check.
So
I went to, so that year it was ever right, I guess. So I went there. And I did the
you didn't do the transvaginal scan.
I did.
You did the transrectal scan.
Yes.
Okay.
Transrectal. I can remember. So I did the hormone profile in that lab. So when that came out, and the doctor said that my hormones were not normal. Like they say, your progesterone is supposed to be so percent. Mine was very low. Your estrogen is supposed to be this. Mine was high. So it was just really messed up, right? I don't know the details. Then at the scan, they said something about how there is a fluid
Okay.
in my was over,
Your ovaries?
over, I don't know that. So
Yeah.
that's what he said, like when they explained the whole thing. So then doctor was like, oh, I should start taking hormone drugs. Mommy
So you
said,
were like far back in 2013.
yes, 2013. And they were like, his hormonal, the diagnosis was hormonal imbalance.
Yeah.
That had hormonal imbalance. And the doctor said, oh, that I should start taking hormone, drugs.
Yeah.
So we went back. Strike was called off in 2014, January of 2014. We went back to school, and that thing was really bothering me. The whole, because of your facts,
Yeah.
right? It really bothered me. I know with the whole fat shaming, I went through a lot of fat shaming. I mean, I had a friend don't call me fat fool. Yes, yes, yes.
But
Your
a friend, though, that person is not your friend.
Yeah, I had a friend call me fat fool. Like, people want to describe me. That girl looks like a bouncer.
When people see that you're having a particular type, they feel you should conform to the standard of what is in their head or what they believe they like. Not minding that we are all unique in our own way. We all have different genetics, different body types, and all of that. Yeah, I'm sorry about that.
Yeah, so I was like, okay, say she fat, let me lose weight. And then I went on this very strict no eating diet. And I was basically on fruits and beans. So I was not eating. I was really not eating, and I lost weight within 6 months. I lost a lot of weight. I mean, I was like, Jesus.
Yeah, I remember that was 2014.
2014, yes. I stopped eating everything. Basically everything. The only thing I was eating was rice once a week, beans. Beans. So I stopped eating everything. Like, I just had, that was when my terrible relationship with food started.
Sorry to cut you short. This is why, like, talking to people in that kind of manner, as you said, you stopped eating and you were only eating once a week. This kind of depression, or this kind of what will I call it, mood,
Yes.
can make
affected
people to affect your mood, your psyche, and it can even
Your
cause
confidence.
anorexia nervosa, which is actually a medical condition that people just don't eat, for psychological issues, and it will affect your self-confidence. It will affect, so people should learn to
You
be
get
kind.
really defensive.
Yes. So kindness is like, when you see someone, I always say that someone is obese doesn't mean that they eat a lot. Someone can be eating little or nothing, but because of one health condition or the other, they are just overweight or obese. So you shouldn't comment on everything. Learn to close your mouth. Like, keep it to yourself. If you have no solution to prefer, or you cannot be really kind, or say it in a way that wouldn't make that person feel really bad or feel very insecure, then shut up. Shut up. Sorry about that.
No problem, it's fine. So I lost weight, and I was like, okay, I've lost the weight. Let the period start coming out. And it was still like that. I was seeing it maybe, let's say, 3 months in a year, 4 months in a year, maybe 5 months, 6 months, and maybe 1 month. Like, maybe comes out January, won't come out February. Something like, just really, the thing was still there. You understand? Like, obviously there will be an improvement, right? Because I mean, as you're growing up, I guess.
Yeah.
But it was still the same, inconsistent period, and I was still not ovulating. You remember they were talking about ovulation?
Ovulation. I was telling you that usually the cervical mucus in ovulation is usually like egg white. Egg white, not the egg white of after you have boiled the egg. Before you boil egg, there's a yolk, and then there's a like fluidy transparent part. That's like the egg white. So that's basically what you see when you're ovulating. There are other signs of ovulation. There's increased basal body temperature. You may have metal smesh. It's like, they call it mid-cycle pain, just mild pain in your lower abdomen, and all of other. But these symptoms are basically subjective, not completely objective. Yeah, but like that cervical mucus one, it's almost always there if you're ovulating. So I can remember the time I was trying to like explain to you what, and then she said, I have never seen that, and I'm like, what?
Yeah. So even ovulation, I was not seeing, because you expect to be well,
Yeah,
like doctor said.
Yes.
So I still didn't see all those things. I was really not worried. You understand? I was not worried. I was still living my life. So when, like, let me now circle back, like circle down, or like take us to when I now finally got my diagnosis.
Okay.
So it was in, okay, so 2020.
Yeah.
So that period was one of my worst periods. It was heavy.
I know it hadn't come in a while.
In a
Usually
while.
happens in PCOS. Normally, your womb, your uterus should basically proliferate for a limited duration of time and then shed. Do you understand? So when you have not seen your period and a month has passed, 2 months have passed, the proliferation continues. The cells of the cells are just multiplying and then multiplying. So that eventually, after probably like 2-3 months, your own was 4 months probably at the time, the bleeding will be more because the cells that have multiplied are like a lot. So all these cells have to shed because your period menstruation is basically like shedding of this lining of the endometrium. That's the inner lining of the womb. They just shed and come out with some blood. That's basically what menstruation is. So when you're not in your period for a while, they just keep multiplying, proliferating, and eventually when the period comes, it comes like heavily and you can bleed for quite a long time, maybe a week sometimes.
No, this one 5 days. My period is like 5 days.
Yeah.
But at least first day, second day might be heavy.
Then subsequently it tapers off. Yeah.
This one from the very first day till the 5th day, I was stained. 5th day.
Yeah, I remember that day.
Remember, 5th day. So it was really heavy. And that was in November. After that November, I didn't see my period. Till that was 2020, Abby?
Yeah,
till 2021 February.
Yeah, I remember February. Wow. So that's November, December. That's like 4 months.
So 2021 February, I then saw my period. It came out. I was like, thank God though, that's come out, right? So I saw it like a normal 5 day cycle. A week later, I started bleeding again. First week, second week, the bleeding was increasing, and then it was coming out with like very thick, like very thick clots.
Yeah.
First week, second week, it didn't stop that. Okay, you have to go to the hospital.
Yeah, to see a gynecologist.
So yeah, so I went. The first day I was not successful. I didn't get to see any doctor. They were like, I'm going to come back during their clinic day. So I went back, my bleeding. The second time I went, so 2 weeks had gone by. So the third week, I went back on Monday. I think the clinic day is Mondays, Wednesdays, Friday. Okay. So I went back on Monday and I said, doctor, like, what's wrong? I said, I'm bleeding for 2 weeks. I said, go to the emergency, go to the gynecologist, emergency gynecology or something. Gyne emergency. So I went there and then I saw a doctor and he started prodding. So they put me on drip, they gave me injection to stop the bleeding. They told me to do like a series of tests, right? They asked me, okay, what are my symptoms? Am I pregnant? I said I cannot be pregnant. And I did all the tests. So after all that, the abdominal scan result came out. And they said I had endometrial hyperplasia.
Okay.
So the doctor said,
yeah, so with that, I'm sorry to cut you short. Let me just explain for people that don't understand. Endometrial hyperplasia is sort of a complication that can come with PCOS, and it's basically, as I explained, when you don't get your periods, your endometrium is basically the inner lining of your uterus, your womb. So it just continues to multiply. Normally, if you have a 28-day cycle, your proliferative phase is going to be fixed at 14 days. So you multiply for 14 days, then you go into your luteal phase and then menstruation. So then if you're not ovulating, proliferation just continues, right? Let me just say this, that ovulation is what makes a cycle regular. So if you have a regular cycle, and regular cycle doesn't mean constant cycle, because nobody's cycle is constant. Your cycle will fluctuate, but there will be a range. Maybe you can have 27 to 29 days, maybe you can have 30 to 32 days. There will definitely be a range. Normal cycle length is 21 days to 35 days, right? So without ovulation, the cycle will not be regular, because ovulation is what shuts down that proliferation, goes into the luteal phase, then menstruation. So without ovulation, it should be regular. So what will basically happen is that your endometrium will continue to multiply, increase in size, the cells will continue to multiply, and eventually when it's tired of multiplying, it will shed. And this can take like months, basically. So endometrial hyperplasia is just abnormal increase in cells in that endometrium. That's basically what it means.
So the doctor then, he said, okay, that's it can be as a result of two reasons. The period thing, or is it a precancerous?
Yeah, it's also a precancerous lesion.
Yeah.
It's a precancerous lesion for endometrial cancer. So usually it starts with hyperplasia, then cancer.
Yeah, because he said that my endometrium was 15.1 millimeter instead of 7 to 8.
About that.
Yes. So he said, oh, there's gonna give me drugs, I'll go back. And you know how federal hospitals are, back and forth. At that time I was 1 month plus
With bleeding.
with bleeding. So that's 4 weeks.
And I'm sure you were dizzy, weak.
Yes, I was. So I was on my 4th week when they gave me the drugs, and
I'm sure they gave you tranexamic.
Trinazemic acid, and then the Primolut. They gave me Primolut.
And
yes. So, but like I don't like drugs, but I was taking the drugs judiciously because I wanted it to stop.
yeah,
Right? I mean, it was debilitating. Do you get? So it was a very. That was one night I woke up, as I stood up, blood splashed everywhere. In the middle of the night, I started washing bed sheets, started packing blood.
I'm actually surprised. Like I don't know all these things, but for the please let's play this part together. Act surprised with me. Thank you.
So it was bad. So I really wanted it to stop. So I just one dose,
tranexamic and the bleeding.
and the bleeding reduced. By the end of that day, I was not bleeding.
So tranexamic acid is basically, they call it an antifibrinolytic. It's basically a medication that is used to control bleeding. So that what tranexamic acid is for.
So that was that. 1 week later, I started breaking out.
Yeah, you had severe
I had severe acne. I started breaking out. Like I had mad ass breakouts. And 1 week later, periods started coming out again. Or was it 2 weeks? I can't remember. But periods started coming out again. I called the doctor. The doctor said, oh, that one is period. Because I had now gone in from February to March. So I was in March, middle of March. So the periods started coming out again. And I had mother's breakouts on my face. But I met another doctor. Because that doctor was already telling me that you might have cancer. Do you want to remove your womb? Yes. I said, remove it. Take it. I don't know. I can't, honestly. So the doctor I met, the female doctor, she said, she listened to me. She put on my file and she listened to me. And she was like, she doesn't think I need a biopsy. That before, like, no problem, since the other doctor said, I should do one. But before we do one, she wrote like hormone profile again.
Yeah.
And then she wrote TVS. That she directed me to a lab to go to. That I should go and do the hormone profile. I should do the TVS first. That she thinks I have PCOS. She asked, have I heard it before? I said, I have heard it before, but
nobody has given you the
yes, not in relation to me.
Yeah.
It's something I know about. It's just, I've never heard it spoken with my name before. And she was like, I should go and, do the TVS. And then I went, I did the profile. She even wrote lipids and fasting blood sugar and everything. And then the TVS. So after the TVS, my result came out, and then you see it. Symptoms
Suggestive of
polycystic ovarian syndrome. Then she placed me on microgynon. So I took microgynon for 3 cycles. So that's how I got my diagnosis.
Wow, that's a very thrilling story, I must say. And this just outlines the fact that people have to be kind. As I have said earlier, you don't know what people are going through. You have to be kind and very sensitive to people's conditions. So another question, was there like a time, or has there ever been a time when you probably felt ashamed or shy to talk about the condition to some people that you were not really close to? Did it ever make you feel sort of different from other ladies, or sort of downcast? Why me? Why me? Why this condition? Why me? And all of that.
I think the only time I may have, thought of that was when that time I was really young and I did that scan and they said,
Yeah, they
oh,
said
that this,
hormone
but like, they told
imbalance.
me that I might not be able to have, a child. I'm not be able to give birth, right?
But, okay, well,
Then that time, I won't say it's a new, is a new condition, but is severely under researched. You understand? It's just, let's say, barely 20 years ago that people started researching on PCOS. It's severely under researched. That time we were young, it was always hormonal imbalance.
imbalance. Yeah.
Hormonal imbalance. So yeah, when you see those things, like how will you give birth? You understand? So that was the little time I would have, I thought of that, but it didn't really bother me
That much. And you were not really,
I was
really
young,
care.
so I was not even really. But so I've never been ashamed of it. I've never been ashamed of it. I mean, whoever cares to hear.
Yeah.
I always talk about it. I've had friends reach out to me and to ask me questions.
How did you?
What are you taking? I always my Twitter. I always tweet about it. I'm not particularly a shy person, so I'm a mad person.
I'm the shy one.
Please, she's not shy.
All right. Okay, so thank you for that reply. One more question. Have you, or what was the symptom that scared you the most? Because I know that PCOS comes with like a wide array of symptoms. Or what was it for you? What was it for you that gave you that fear? Like, oh, can this be really serious and all of that?
That bleeding. Hey. So that night I woke up and the blood poured everywhere. Right, I was crying in the bathroom when I was washing the bed sheets because I had to wash the bed sheet. I had to scrub the mattress. I was crying, and I was washing the bed sheets in that bathtub. I was still bleeding. I was like, am I not the woman with the issue of blood? So even after they gave me the drugs, I think they didn't give me the right one at first. I was still bleeding. I was like does not have cure. Since the drug is supposed to stop the bleeding, it's not stopping it.
Still stopping it.
Then I took microgynon for 3 cycles and I started seeing my period. Then it stopped in 2022. February of 23, it happened again. I bled for 3 weeks.
How would you advise our viewers that may have similar condition? What would you advise them? Maybe what to do, what not to do. If you have any mistakes you made or any regrets or anything you feel you would have done earlier, you can just like put it out there for them to.
Okay, so before I answer your question, I know there's a huge stigma around period health, especially in Nigeria.
Yeah.
So there's a huge stigma surrounding talking about it.
About menstruation.
Yeah. So people hear you have PCOS or hear that you're bleeding and they automatically think that you want to do abortion. You've not heard it before.
This 21st century.
Hey! Or you want to go and buy, what they call it, that contraceptive, the microgynon.
Yeah.
So there was this one time I ran
because
out.
normally people that have PCOS, they'll normally place you on birth control pills to regulate your cycle.
So I went to buy. I ran out because the hospital was giving me for free. So I ran out and I went to get one. And I was like, oh, please, I'm looking for microgynon. I said, oh, what's that? I said, birth control. They're looking at me like this.
Like, hey, much in birth control.
Yes. In a romp. They didn't give me. They're looking at me weirdly. So I know there's a stigma surrounding it and you might be going through it and then you keep quiet. Okay. Or maybe you're sexually active and you don't see your period for a while, but pregnancy is not coming. But then you're scared that maybe you're pregnant and then you keep quiet. My advice is, go and see a doctor. Not just any doctor. Go and see a gynecologist.
Yeah.
Go and see it, and not just any gynecologist.
A good
one. People that know what they are doing
in a standard facility.
Do you get? Not just anybody, because you can go to one person and they'll tell you rubbish.
Yeah.
See a doctor. Talk about it. Ask questions. Don't see it as something you have to hide. Do you get? Don't see it as something you have to hide.
Because you have to be open and seek help, but only seek help from people that understand the condition.
Yes, you have to seek help. That's my advice.
Thank you. So thank you very much, Doctor.
Dr.
Doctor to be PhD soon. PhD in view. Thank you very much, Chisom Ogamba Paula, for this session. Thank you for pouring out your heart and saying your story without holding back any detail. I hope my viewers are enlightened, and I know that right now anybody suffering the same symptoms or know someone that has similar symptoms would try to help the person to seek medical care promptly. And thank you so much. So guys, just to round up what she has said, because she has basically said like literally everything about PCOS, basically, because she's the horse, like you've heard it from the horse's mouth. But like to just round up what she has said thus far, PCOS can be managed. That's one thing I want you to know.
Yes.
It's not something, it's not a death sentence.
Yes.
It's not, and it's not even everybody that has PCOS that ends up having fertility issues.
Yes. My last visit to the doctor, the last doctor I saw that placed me on metformin, he told me that my body is releasing egg normally. Even the first doctor, that the female doctor, she said that whenever I'm ready to give birth, I should just come. They'll place me on a drug.
Yeah.
You just it's not a problem.
Yeah. So they are
it's
like
just how you manage your hormones.
Exactly.
Yes.
So that's what I want to say. It's not a death sentence, and it doesn't outrightly mean they're not going to get pregnant, right? Because there are medications that can help you achieve pregnancy. That ovulation induction medication that they can give you when you're ready to take in, and other medication that the doctor can give to you are metformin, as she said, because PCOS comes with insulin resistance, so you kind of have symptoms of diabetes. So metformin helps to regulate that. So there are also medications that can help control the level of androgens in your body. There are also medications that may help you to lose weight. There are also medications that may help your acne, like medications to basically treat the different symptoms that come with PCOS, right? And also there's like lifestyle modification, and for weight reduction, and surgery is also a modality. But yeah, before it gets to surgery, then all medical management protocol have actually failed. So PCOS can be managed. PCOS is not rare. Like I actually know currently I have like 5 people I know that have PCOS. So don't be scared about it. Don't be ashamed to talk about it, to ask questions, and very important, visit a gynecologist on time so that you can get treatment early. So thank you to our guests, Chisom Ogamba.
You're welcome.
Give me 5.
You're welcome.
Thank you for watching my videos to the end. I hope you subscribe. I hope you like this video and enjoy it as much as we enjoyed filming it. I hope you comment, share with your family, your friends, your loved ones, your well-wishers. And if you're happy that I brought a sweet guest to the channel today, let me know if you want to see more faces on this channel. All right, guys, see you in my next video. Bye.
Bye-bye. Thank you so much.